this next segment, we'll just be talking about the prevention of coronavirus. We'll be talking about ways to protect yourself from COVID, and we will also be discussing key terms such as social distancing, quarantine, and isolation. The first recommendation from the World Health Organization regarding protecting yourself from COVID-19 is to wash your hands frequently for at least 20 seconds with soap and water. So it's most important to wash your hands after spending time in a public place or after you cough, sneeze, or blow your nose. You also want to really avoid touching your face, which is your eyes, nose, and mouth, with your hands, because these are the areas that are most vulnerable to becoming in contact with the virus, so avoid touching those areas of your face. And it's also important to wash your hands after touching any surface that has not been recently disinfected. So it could also be easy to just keep some hand sanitizer on hand. And obviously you can't always know whether or not a surface has been disinfected, so when you're outside the house, you just want to constantly be disinfecting your hands after you touch things, because the virus can stay on a surface for up to 3 days at a time. So make sure you read the label on your hand sanitizer and make sure that it has at least 60% alcohol in it. You want to make sure that you can use any kind of soap. Some popular brands such as Key Soap, Sunlight, Geisha soap, any of those soaps work very well, and it's really important to also use clean water when you're washing your hands. And it is best to use soap, but if you do not have any access to soap, you can also just rub your hands under some clean running water really well and then wipe your hands off with a clean towel. The next safe practice that you want to use to prevent coronavirus transmission is avoiding close contact with people. 1 in 4 people are actually infected with the virus but do not show any symptoms of it. So it is really important to keep that in mind as you practice your social distancing. So social distancing just means keeping a distance from yourself from other people when you are outside the home. So when you go out to the market, the store, pharmacies, wherever you need to go, you really want to make sure that you are at least 6 feet away from other people. Social distancing also means not gathering in large groups and staying out of crowded places and mass gatherings. Quarantine is actually different than social distancing. Quarantine is for people who may have been exposed to the virus, and quarantine is a method used to keep people who are exposed away from people who have not been exposed to prevent further spread of the disease. So for example, if someone recently traveled, they should stay quarantined because they've probably been exposed to the disease either at the airport or on the airplane. So because they've been exposed, they need to place themselves in quarantine for at least 2 weeks, because 2 weeks is usually when symptoms of the disease start to show. So if no symptoms start to develop in them after 2 weeks, then they are no longer considered a risk to the community around them. The isolation is for people who are actually sick. So people who are sick need to be isolated from those who are healthy. So if there's anyone with coronavirus, they need to actually be placed either in a designated room in a hospital or in the home to prevent the spread of the disease to other people around them. So just remember to stay home as much as possible, and if you have to go out or go to work or go to the store, remember to stay home if you are experiencing any symptoms. Another recommendation is to cover your face with a nose mask when you go to a place that might be hard to social distance, such as the market, or if you have to go to a crowded place. It's really important to cover your nose and mouth because it is from your saliva and mucus from these areas where droplets of the virus can spread and expose other people to it and how the disease is spread. So if we cover our mouths and nose, we definitely lower the chances of the disease being spread through cough, sneezing, and talking. Always remember to cover your coughs and your sneezes with a tissue or into your elbow, and the second after you cough and sneeze, you want to immediately wash your hands or use a good hand sanitizer with at least 60% alcohol in it. Lastly, you really want to remember to clean and disinfect frequently touched surfaces often. So anything like tables, doorknobs, light switches, phones, toilets, and sinks, you really want to disinfect daily. I will reinforce that the virus can stay on a surface for up to 3 days. So you really want to disinfect these surfaces as often as you can.